of the world, we tend to just say cheers when we have a drink together. So that is a Manx toast, and it means, the first two phrases mean good health and long life. And I called the game BEA VEAYN BINGO, partly because it, I believe, will help people live younger, longer, and partly because I'm just crazy about alliteration, and BEA VEAYN BINGO sounded better than Slant Vi Bingo. So there's three things I want you to come away with. The one is, it's really important that you know how to spell it. So if everybody could say after me, BEA VEA, why not? The reason why not is the YN. And the reason is that you're going to leave here and you're going, gee, that was an amazing game that we learnt today, but I can't remember what it was or how to spell it. And you'll try and put in something that looks similar, and I guarantee you will get being vegan coming up. So my mission is to get the whole world to start putting in BEA VEAYN, and when people put being vegan in, they'll get BEA VEAYN. The other one is how to pronounce it, which I have written there, BEA VEAYN. Once again, say after me, BEA VEAYN. Great. Probably more importantly, with regard to a conference, is how and why playing the game is going to help people live younger, longer. And most of it is based on the research that many of you are doing. I just read it. I have worked in research, but I'm more of an evaluator. I've been a health promotion officer for many years, and I have worked with vulnerable population groups. Those of you who have worked with them may relate to the fact that sometimes engagement is not easy into some kind of health program or health behaviour, or even getting them to understand health knowledge. We do very serious research. The government has serious decisions to make about where to allocate their funds for health. But the people on the ground are only going to be engaged often if they're having fun. So BEA VEAYN Bingo is about accumulating knowledge by having fun. Anywhere in the world, engagement involves a lot of F words. We have food, fun, familiar settings, famous or familiar champions. That was a celebrity on the island who was launching the BEA VEAYN Bingo at a social club on the island. And the people that come along might also use F words and others. I did tell our young friend there that I would make her world famous for saying the F word. And there we have her. I won't mention her name. Jean, if you ever want to know. If you meet her, say, I saw you swearing in Singapore. It actually originated in Australia. I was stuck there for COVID for 17 months after going for a 2-week holiday to visit my daughter. And I got involved in a program there. I'd worked there previously, and I was invited to run something called the HOP, the Healthy Outreach Program. And as part of the celebration at the end, I thought, well, let's throw a bingo game together. And I randomly chose some images off the internet without doing any research. We had 20 images, and we only did a line across. For the game that we're playing, we're going to do across, vertical, even diagonal, you can win. And the feedback was so, just everybody loved it. The professional people loved it because we were dealing with 29 organisations that worked with vulnerable population groups, which included people with mental health issues, aged people, there were an Aboriginal community, there was what we call the CALD, culturally and linguistically diverse communities. And all the people that came along to it who had been in the HOP program just loved it. So I thought, you get something good, you make it bigger and better, because that's what we do in the Western world. And I started reading the literature. Mainly, I started just with dementia prevention, but I'd worked in type 2 diabetes prevention for many years, and the depression as well. I just finished a grad dip in psychology. I'm still down at that grad dip level. And also, I found that there were just so many correlations, we've heard that already today, between what you need to do for your mental health, your physical health. They're all interrelated. We're a whole being. We're not just a sort of series of, it's my nutrition that's going to do that, or it's what I meditate is going to do that. It's the holistic combination of the lot. You can see again that I'm nuts about alliteration. And I found that they seem to fit in these 8 categories, many of which we have heard about today. I won't go into them all. You can look it up on my website if you want to see what they are. I have colour-coded them based on feedback from the pilot sessions that I've run, just to make it easier for people to find. I think nutrition is dark green and altruism might be pink. Anyway, I can't remember, but I did draw a lot of colours on those sheets the night before last. Living younger longer fits in very well with the World Health Organisation's definition of functional ability in healthy ageing. I love this. Who remembers Venn diagrams from when you were at school? This is the Venn diagram for developing a healthy lifestyle, living longer, healthy ageing. Is Preeti still here? Preeti was talking about nutrition earlier. My first degree was in nutrition, and I was quite disappointed at how small nutrition was on the Venn diagram. Most of the influence is coming from the social side. I'll just show you a bigger version. Also, financial security is in there. I haven't included financial security because of the populations that we're playing the game with. I don't want people to feel threatened or useless or hopeless. But otherwise, they tie in quite in a similar way to what I have as the 8 categories, plus the miscellaneous and advocacy, which is very important. And I'm a bit of a pushing everybody on the Isle of Man, and I'll be in Australia soon, saying advocate, get those politicians to make the world conducive to being healthy. Those were the criteria for inclusion. Prevention of those 5 Ds had to be evidence-based. I tried to use only very recent studies and huge reviews. Most of them are actually from the last 3 years, but I haven't. If anybody knows of a study that recommends the amount of time that one should not sit continuously for, I only know of a 2015 one, which is 55 minutes. So if anyone is aware of a more recent one, please let me know. Inclusion also has to appeal to the participants. It has to be relevant, non-judgmental, and also avoid confusion. People found, this is a sample of the original one, that the ones with the crosses on just looked too similar and they were ticking off the wrong one. A lot of the people are not literate that come along, so I had to make sure that the images were quite different. So that is one of the reasons that there's not really a theme to the way the images look. They're purposely different. Another one was that they thought when they got them that they were free squares, because when you're marking them off, you do a cross. And if they had 2 of those with the crosses on, they thought they had 3 squares and they'd be closer to winning. We had to get our slides here before I had that feedback. So when we're playing the game, note that the cross has been replaced by a little symbol for danger. So if anybody's got one with a cross on, sorry, you won't have the cross. You'll have the little danger symbol, but the slides still have the cross on, and I'll point them out when I get that. Exclusion. I mentioned the financial security. Also, there's a lot of research about cold water swimming. You'll live forever if you swim in the Arctic, unless you have a hypertension or a heart disease or exercise-induced asthma, in which case you'll die sooner. So that is why I've left some of them out, because I don't want to put the people that are coming along at risk. We don't want to sound preachy, because nobody's going to come along if we say this is what you should do and that's what you shouldn't do. I just say this is what the research says will make you live younger longer, but it's up to you what you do. Most of them, except for the nutrition ones, have a positive valence, as what they say, do this rather than don't do that. I believe that, I think it's Kenneth Pelletier is doing a talk, and unfortunately I'll already be on the plane when he's doing it. It's about 11 o'clock on Saturday night, because it's UK time that they're doing the virtual conference. And he's going to be talking about epigenetics, because originally on that poster I had, we can't change our genes or our age, but of course the epigenetic studies is showing that, oh, we can at least change gene expression, and I'm sure a lot of you here know more about that than I do. I will be, hopefully he's going to let the presentation be on YouTube so that I can see it. This is more of the advertising, and we push the fact, and I also announce it to everyone, and I'll say it to you now, even if you don't win a prize, everybody wins the inspiration to live younger, longer. And I was ecstatic, because a couple of days after our second session, I was in the club meeting the lady who organises everything, and I overheard someone behind me say to her friend, "Did you come to that other bingo on Tuesday?" And she said, "Yeah." And she said, "Did you win?" And she said, "Everybody wins at that bingo." And I was so pleased. That's just more of the advertising that's in there. And it's got that same line there about you might win a little prize. All the prizes, by the way, relate to promoting health. And when I have them there, we have the little image from the bingo card on it that says which one it relates to. That next one there would have on go on a holiday with friends, or what else have we got? That's to do with hygiene and or breathing only fresh air. Exercising your brain by doing puzzles. I'm collecting prizes all the time. If I won't collect any here because I've already got too much luggage. I'm not going to go through every image on the slides, but these are just, I'll flash through the different images. The nutrition is green, personal physical activity, social physical activity, other social activity. See, social and physical, very important. Mindfulness and meditation. Thank you very much to the two previous speakers. I don't have to say much about that because everybody knows all about it now. Altruism. Has anyone heard of Martin Seligman? Any psychologists here? He's the father of positive psychology. He's done lots and lots of research into what helps people feel happy or be positive about life. And he has found that there is one cure, yes, cure for depression, and that is altruism. So we've got lots of different images for different types of altruism, and there's research behind them all. Skills and self-efficacy. I always have to explain what self-efficacy is in the groups. I think most people here, does anyone want to know what self-efficacy is? Basically feeling capable, feeling that you are able to do what it is that you're planning to or trying to do. And then, of course, hygiene and medical matters, and all the nurses here will know a lot more about that than I will. And I think through the whole COVID procedure, we've learnt a bit more about hygiene, because we got a bit slack once they introduced penicillin and all the antibiotics. And I think we're going to have to get back into good hygiene. And then the advocacy and miscellaneous. So, yeah, don't be afraid to push your politicians to make the world conducive to good health. I can see all the epidemiologists in there looking at those figures and going, 13 feedback forms. That's not very valid as far as the interpretations go or any claims, but welcome to the world of vulnerable population groups. They got a raffle ticket if they handed in their form, and there were 18 forms in the bag and 5 of them were blank, but they still got a raffle ticket. I was really surprised because a lot of the people were there would be what I would call the sort of pre-contemplative on the stages of change model, as in, do you intend to make any changes in your life? I was quite surprised at how many of them indicated that they did want to make changes. And the little feedback form that you all have there, which has not been validated or anything, it's just a bit of feedback. It looks at whether people's awareness was raised or whether they stated any intention to change any of their behaviour. So that was quite interesting. And yeah, 91% were reminded about something they knew already, and 82 learnt something new, 82%. It's just more, not very valid statistics, but it's just an indication that I was quite pleased with. I was thrilled with how much they enjoyed it, and I was given those helpful tips to improve the game, like the colour coding and the not having the crosses on it, and they, I'm sure, will continue to give me feedback because they're quite a vocal lot. And I've also been invited to do other locations on the island, and I'm hoping that eventually I will be able to train other people. I'd like it to be run by health professionals, but that I'll be able to train other people to run it with their vulnerable population groups. It's some of the comments. And some of them were making recommendations. They wanted signposting to where they could go for help, so that's something useful that I know now to take along. There's an abundance of research opportunities there, so I don't know whether it'll be me or other people, but it will be great to find out whether this game really does make a difference in the lives of people and the health of people who otherwise may not access health education. And next steps, as I said, I want to develop a facilitator guide and different resources to make it fun and accessible for more people. It's very much in the early stages. So I hope that everybody spell Bear Vein? Would you like to try it on your own without looking at the slide? Yes, well done. And how do you say it? Bear Vein. And do we know how and why people are playing it? If you don't yet, you will after the game. And we hope to engage people from all walks of life. It'll be relevant for workplaces as well. It doesn't have to just be vulnerable population. It could even be run in universities. You could have it as your sort of staff do. In a health centre, you could have a game of BEA VEAYN BINGO. I might leave the questions till after the game, okay? So let's play, and we'll just move on to the other slide. Right, you ready? If you get a line across, yes?
I think there's a handful of people on this slide that didn't get markers.
Then they need to share with somebody because, as I said at the beginning, they will have to come and share. So if you share with somebody, you will both get a prize. Okay? Or if there's some friends, oh, they didn't get a marker. Do you need anyone need a marker? Is there any left? No. There's still some markers here. So. All ready? The first one is a pale blue one, physical activity guidelines. That particular image is the UK one. I know Australia has them too. Does anyone know if Singapore has physical activity guidelines? Hong Kong? Yeah. India? Yeah. Good. So you just mark that off. You can just do a little cross in the corner that's easier to rub off, or you can do a great big one if you want it to be. You can do a great big one if it's easier for you to see, or you can do a circle. You can do whatever you like as long as you know when you've ticked it off. Has everyone read the back of the card? If you get a line, please shout out BEA VEAYN. And if you get the whole lot, you shout out BEA VEAYN BINGO, okay? Right. Purple one, active play together. That way you get the benefit of the social side, the fun side, stimulating all those positive chemicals in your brain. And I don't use the technical terms for those because nobody knows what the various endorphins are or right, ready? A yellow one, have a laugh together. That's one of the most important ones. We get so serious sometimes, especially when we're surrounded by serious people or people that we think we need to impress by being serious. But don't forget to laugh. Have a good laugh with each other. Make an idiot of yourself. Lobby, a red one. That's advocacy. Lobby for investment in prevention. You're all going quite quickly. I see you're getting them quite quickly. No, you're still looking? You're okay? Mindfulness and meditation. I think somebody mentioned that originating from Buddhism. Be here now. No matter what awful things are going on around you, just breathe, be here now, and you'll find that you will live longer. That one I think is supposed to be dark blue. And that is manage your cholesterol levels, which of course initially should be done with diet. Some people have a condition where they need to take tablets as well. Keep track of it, because if you end up with too much cholesterol, you might not live longer. And a pink one, support a charity. You walk out the door and some people are collecting for the equivalent of the Heart Foundation outside. Pop a dollar in. And another dark blue one, health screening. If you live in a country where the government sends you reminders to do your health screening, don't throw it in the bin. Do it. Some fairly new research, it's only come in the latest, the Lancet is doing a lot of research in healthy aging, and it's only in the most recent one that the link between dementia and deafness. If you address your deafness and you get your hearing aids, then you won't be as susceptible to dementia. So don't ignore signs or encourage people that you know if you feel they're not hearing you. It may be selective hearing, as it is with my partner, but sometimes it is actually a condition and it can be addressed. A green one, drink water. Bare vein, we have it, no, bare vein, we have a bare vein. Would you like to read them out, just so everybody can check that you have ticked the correct ones off? The ones that you have in a line.
Manage blood sugar levels.
I don't think did we have managed blood? We had managed cholesterol. I don't think we had managed blood sugar yet. Have we? No. Okay, well, that's all right. People love, in bingo, everyone loves a false call because they've got hope of getting another one. False call, everybody, we get another go. Never mind, it'll come up soon. Garden together, a purple garden together. And yellow, why not attend a show with friends? And an orange one, get creative. There's a whole lot of research coming out about, what's that word for getting in the zone? There's a new term and it's just gone out of my head, but it's about just completely getting engrossed in what you're doing to such an extent that you're oblivious to everything else. And that is very good for your brain and preventing it from aging, because it's relaxing, but it's also a creative space. And a pink one, forgiveness. It not only makes the other person feel much better, but you will find a whole load lightened, and it'll reduce your sense of depression and anxiety if you can genuinely forgive. We're terrible at hanging on to resentment. I think women are the worst. If I'm allowed to make a judgment on gender, I do believe that it is validated in some research, and I can't quote it right now, so I should keep my mouth shut. And pale green, do puzzles. That's part of your skills and self-efficacy. Do puzzles. Keep the old brain cells activating. No calls yet? Now the dark green, nutrition, limit processed and red meat. That is one that you won't have a cross on it, so you have to try and look for the image of the sausages and the bacon and the steak with a little danger signal on it. I'm sorry about that, but I had already sent them. That's not confusing anyone? So don't look for the cross, look for the sausages and the bacon. And avoid them, don't eat them. I had a sausage for lunch, so I can't really talk. but limit them. I didn't have 10 sausages for lunch, I had 1. And a pale blue, balance exercise. If we don't fall over and bang our heads, we'll live longer. Yellow, join a social club. Or go to a conference. They're pretty similar, aren't they? It's an opportunity to network and socialise with other people. And an orange one, fresh air and nature. Plenty of We've got a BEA VEYN. Where's the BEA VEYN? We've got a BEA VEYN at the back. Do you want to call out the ones you have in a row?
Yes, forgiveness, lobby, fresh air and nature, support and charity, physical activity.
Which physical activity?
Physical activity guideline.
Yes, oh, the guidelines, yes. Would you like to come up and choose a prize off the table? And we're going to play for another line, because we still have, I think we have about 8 minutes left, so nobody's going to ask any questions, are they? You're just going to play till the end. Is that all right? You can ask me afterwards. You can come and see me at the end if you have questions. You take whichever one you like. Oh, I'm so glad, because that was making it so bulky in my suitcase. I was hoping someone would pick that one. No, keep your sheet as it is, because we're playing for the next person to get a line again. We're not going for full house. We're going for another line. Altruism. The pink one, being generous. And a pale green one, take on a mental challenge. Oh, we have another one, the same person, wow. That's not fair, is it? I'll do one more, but come and get your prize, come on. Wow, you're in luck. Who shuffled these cards? That's what I'd like to know. You've been at the computer over there, haven't you? You can't have that one, because that's the container. You put nice fruit juicy things in there. That's well done. I was just going to say the mental challenges. Yeah, mine's down there. It could be trying to remember your PIN number. That's the biggest mental challenge I have, because just when I think I know what it is, then I have to change it. It could be doing a PhD, or in my case, it might just be learning how to embroider the letters of the words PhD or anything else. Nutrition. Very good advice for your plate, your dinner plate. Oh, we have another one. Well done. Please come and choose it. Yeah, of course you can. You can have anything. I love it when you take the heavy ones. We've got another one. Come along. Huh? Is it? They're all in that corner. I think they collaborated and they went over there and they moved all the, yeah. Any of those, you can have one of anything. The masks are reversible. There's a tea tree, yeah. Yeah, that comes under hygiene, health and hygiene, I think. How are we going time? Is that the time up, or is there 5 minutes? 5 minutes? Do you think anyone's going to get to a full house in 5 minutes? I think so. We'll go quickly through them. Okay, we're not going for a line now. It's got to be a full house. You have to have every single one ticked off, all right? I'll go quickly through them. Learn a new physical activity. I'm going to learn to play croquet when I get back to the island, because it won't be snowing there anymore. Purple one, yoga, tai chi or Pilates classes where you get together with other people to do gentle meditative exercise. But a full house is when every single square is covered. So you've got all of them. Everybody's got different images on their thing. We'll tell you that there is another one with the lotus position, so don't be confused between the two. It's got to say yoga, tai chi, Pilates classes at the bottom. Okay? But there's the other one, meditation or prayer. People who pray or meditate live younger, longer. Neighbourliness, that's a pink one. Again, that's part of altruism, being nice to your neighbours. Pale green, this one I always have to explain. Does anyone here know what internal locus of control is? You do? Do you want to tell the world what it is? Yeah. Yeah, and to add to that, the internal locus of control doesn't blame somebody else for everything that goes wrong in their life. An external locus of control is when, for example, the one on the left is cursing the weather because it's broken his umbrella, whereas the person on the right thought, it's really stormy today, I'd be very silly to go out with a flimsy umbrella, I'm going to wear my heavy rain gear. It's taking control of your life and not blaming other people for what doesn't go right. Dark blue have regular medical checkups. I do find that some of the men that I know are very good at delaying anything they don't want to know, head in the sand. I've got a girlfriend who does the same thing. It's like, and she also says, oh, I don't want to bother them. I know they're really busy. And I said, well, if you get very sick, they're going to be 10 times busier. So rather go and see them now before you do get very, very sick. Nutrition, make sure you get enough calcium. So, oh, you got all of them? No, all of them? Yeah, it's not a line now. It's the whole lot. You haven't got it? Is anyone close? No, we might not get to, baby. Okay, let's go quickly, 2 minutes. Manage blood sugar levels. That's a dark blue. Seize every opportunity for physical activity. If you get to the supermarket and there's a car park right next to the door and there's one at the other end of the car park, you say, yay, I have been given the opportunity for physical activity, and you park at the one that is furthest from the door, because that's going to help you live younger, longer. Celebrate it. Water-based group activity, that's for those of us who've got bad knees and hips. We've got no excuse not to do exercise, and we can enjoy it if we do it with other people. That's a purple one. And a red one, avoid prolonged sitting. That's the one I'm looking for a recent reference for. Currently 55 minutes. You've got to shout out, BEA VEAYN BINGO. You've got all of them. Well done. Hang on, what's that one there? It's the whole lot. You've got to have the whole lot. That one? No, you haven't got that one. And that one. Yeah. False call. We get another go, everybody. Yellow, share a meal. 1 minute. Pink, community volunteer. Red, lobby for safe walking and cycling. Pale green, believe in your own strengths. Wasn't that the one that was missing? That one is, again, it doesn't have the cross. Manage your alcohol intake. Follow the Eat Well guide. We must be getting close. Stretch, pale blue. Cycle together. Share special occasions, yellow. Yes, we have one. No, false call. Being grateful. Anybody being grateful? I think you're all going to win it. Oh, you've got it. Okay, I'm glad just one, because I thought everybody's going to have all of them at the same time. They're all waiting for the same one. Come along, and thank you very much. If you do have time, please fill in that little feedback form. It'll be nice to see if there are any differences between the ones I get from you and the ones I get from the people at the community centre. Thank you. Yeah, just if you would like to try and clean your own ones, that would save me a lot of trouble. They do come off easier if you go round rather than go up and down. But if you don't, just give them to me as they are. And I think that, oh, wrong. That's the end of that.